Okay. Well, hi.
Hello.
I'm Petra, and what's your name and the your position?
My name is Zach Scott. I'm a certified medical dosimetrist at Riverside Health Systems in Newport News, Virginia.
Okay. What type of education did you get?
I have a four-year undergrad biology bachelor's degree from Longwood University. I then went into a certification program for radiation therapy. And then a few years later, I went back and got my certificate in medical dosimetry.
Okay. What inspired you to get into your current field?
So my mom is actually an X-ray tech, and radiation therapy is kind of in that family. And when I got done with my undergrad, I kind of didn't know what I wanted to do. So I talked to her, and she talked to her boss, and they said, if you really want a good job, pays pretty well, like is like a 9 to 5, and not like having to do weekends and overnight shifts and stuff. Like, you should check out radiation therapy. And I did. It was a really interesting field. I got into it. I love the therapy part of it where we actually work with the patients. But going through school, you have to go through a dosimetry rotation where you learn about the other part of the business and where the plans come from that you're actually putting on the patients and delivering their treatments. And I thought that was really interesting. And pretty much once I did my rotation, or like I think it was like 2 or 4 weeks back when I was a student for therapy, I knew that I wanted to do dosimetry. And after a couple of years of therapy experience, I decided it was about time to do that.
Mhm. How did you get into your current position?
Um, so after I graduated from dosimetry school, I actually came back to the Hampton Roads area and worked at the Proton Center as a therapist where I'd worked previously while I was looking for a job. And to my luck, a position opened up at Riverside, and I applied, and I went over and did some shadowing, and I got really lucky, and they decided to take me on.
What are your basic roles and responsibilities?
As a dosimetrist, our primary responsibility is to design for patients who have cancer and decide to have and need to have radiation treatments. Our responsibility primarily is to work with the physicians and physicists to design a treatment plan that will hopefully cure, but at least treat or palliate the patient's cancer while not hurting them. We also are responsible for a lot of things like working in the chart and proper documentation of the work that we do. As dosimetrists, most of us do a little bit of billing, which is required along with the work that we do as appropriate. Um, yeah, other parts are obviously clinical. We get calls sometimes from the therapists or the CT people who are doing the simulations for our patients that want some insight and maybe some recommendations on the best way of properly laying a patient down, or should we have their arms up higher or lower, or they can't tuck their chin low enough for us to treat. What can we do? So there's a clinical aspect to it as well, but primarily we're behind the scenes kind of doing a lot of work.
Um, would you describe your work environment as sustainable or climate friendly?
Um, I think in our field in general, in medical, that's already happened a lot over the last, well, I'm not have been in the field that long, but probably over the last 20 or 30 years, a lot of things have gone more renewable and such. Where you can use reusable things that can be cleaned, you do. But obviously with medical, there is waste. There's things that just can't be reused. In our clinic, we have a lot of things that are reusable. So for example, back in the day when they laid a patient down on the table to be able to lay them down and have it be reproducible every day, they would create something called an alpha cradle. And if you've ever seen the foam that they pour into the bucket and it shoots out and hardens, it was a chemical reaction, and they did that. The problem with it wasn't very sustainable for getting rid of it, and it's harsh chemicals. And it's not reusable in any way, shape, or form because you make it and you throw it away when you're done with it. So the majority of our industry has switched over to what we call vac bags. All it is a pad filled with beanbag little BBs, little styrofoam, and you suck the air out of it, and it holds its shape for as long as the patient needs treatment. And when you're done, you clean it and you can reuse it. So I'd say overall, our industry is pretty sustainable when it comes to things like that, but obviously because of medical, there are limitations.
Mm-hmm. Do you think sustainable climate-friendly practices are important in your work environment?
I think they're important. Well, everyone should be thinking about it where they can within reason. Unfortunately, there are places where there's just no way around what you're doing and the ways and the chemicals you use and the technology you use. Um, I think that in medicine, though, like I said earlier, we try to be as best we can, but obviously there's things we just can't reuse. But I think we're at the point, though, at least in our part of the business, in radiation therapy, that we've kind of hit that plateau of as far as sustainable as we can get until the next generation of something is designed. Where, like I said, there's certain things that have to be thrown away, and there's certain things that we are reusing. And for the most part, anything we can reuse, we already do. So I do think it's important.
Um, in your work environment, are there any measures or programs in place to practice sustainable measures?
Well, like I said, with the equipment we use, we already do reuse what we can. At least at Riverside, we do have a recycling. Sometimes it's picked up. Um, and I know as far as the hospital, which outside of what I deal with every day, but the hospital is always trying to do things to go green and be sustainable as possible. I'm pretty sure we have a sustainability officer or something like that, like a whole department that's always looking at ways to try and make us green, have a less carbon footprint and things like that. So it is important. I just don't know what else much more we could do and where we're at.
Okay. Do you know of any barriers for sustainable practices?
Um, well, like I said, with medicine, I think the biggest one's going to be that um, some things just can't be reused. So in our department, things that we can't reuse, for example, would be head and neck patients will have a mask that's made for them. It's a one-time, they make it, but it's designed for them. And there's no way of really, number one, for sanitary reasons, reusing it. And number two, the material really can't be salvaged once it's been used. But there's just not, I thought about it last night. I was like, there's just not much more we can really work on, at least in our little department.
Mm-hmm. Do you have any specific recommendations for more sustainable practices that could be adopted?
I really couldn't, at least where I work, I really couldn't think of anything. We've already done things like where the majority paperless, for example, everything we do is electronic. There's not huge paper charts like they used to be back in the day, wasting paper. We still do print a little bit of paper, so maybe that's one of the things, like if they were to start using like tablets to sign consent paperwork with the patient, as opposed to having to print something and actually scan it in. So I guess that would probably be the one thing I could think of off the top of my head that they could do that would be a little more sustainable.
What's your favorite aspect about your job?
Um, it's never the same. So every patient's different, every treatment's different, and it's never dull, I guess you could say. You're doing the same job. Like, for example, I'm designing a plan for another prostate patient, but this guy has a metal hip implant that changes things up and makes you have to rethink everything. Or you have a patient who's previously been treated for some other radiation or has something else going on in their life, or they have a pacemaker, for example. So it always adds a little bit of excitement to what could be a rather mundane Monday, for example. But you get these interesting patients and you get to hear some of their backstories. In our positions when we're on site, that sometimes they might call us in and we might have to help set them up and move them from table to table, whatever it might be. So you do get to meet them and change things up as well. So I'd say that's about it.
What is the most surprising aspect of your career?
Surprising aspect. I think it's probably that if I told someone I was a certified medical dosimetrist, they have no idea what I do. And it's really hard to, other than I tell people that I color for a living, I play with geometry and laser beams. That's that, without showing you and really going through like about a 20-minute lecture, it's really hard to tell you what I do for a living. And the same thing with our entire field of radiation therapy. Unless you or someone you know have gone through it and actually experience it, or at least do the research on it, we have a whole field that people have no earthly idea what radiation therapy is and how it works. So I think that's probably the most surprising part.
What is the most challenging aspect?
Well, like any other job, I think the most challenging is everyone has, I won't say their own opinion, but their way of doing things. And with my position, I do work with, well, for example, the doctors have the final say. It's their patient. I'm helping facilitate the treatment that they think is best for the patient. And if I'm working with one doctor who might do it one way and another doctor who does it another way, sometimes that kind of makes it a little bit difficult, where it might be a completely different technique or the amount of radiation they're giving them. There's also, like, for example, medical dosimetrists in the I won't say the hierarchy, the chain from starting the patient to actually I'm sorry, from simulating the patient to the point where they actually start their radiation. We're about a third or 2/3 of the way down the line. So there's already decisions that have been either made or had to be made before that. So for example, if a patient comes in and they don't call the dosimetrist because it's a hard simulation and the patient's not very cooperative, they might simulate them in a position that is less than ideal. And if they had just called us, we might have been able to go in there and help coach the patient or offer another way of doing something that would have been theoretically maybe a little bit better for the patient when it comes to the treatments. That's probably up there when it comes to trying to figure things out.
And what advice would you give to someone getting into the health field?
Things are changing. Things are changing very fast. There are a lot of things that you have to do that don't make sense sometimes. So for example, and when I'm saying that, I'm referring primarily to the fact that sometimes doctors aren't allowed to just do their jobs. They have to do what the people who are paying the bills say they have to do. So for example, in our field, sometimes we'll have to do multiple plans on the same patient and submit them to the insurance companies before they'll pay for the better one. Because according to their rules, this should be treated with this somewhat basic technique that's a lot cheaper to produce. But current literature or just standard practice in the industry is to do it this way, which is more advanced and costs a little bit more money, but it's statistically better for the patient. So we'll have to go through and do 2 times the work and have the doctor call the insurance company and defend why the better one is a better option and why they should pay for it. And that's probably not rampant across all of the healthcare industry, but a lot of times, unfortunately, insurance does dictate a lot of things about what the patient's care is going to look like. And it's something to be cognizant of, where you go on to do medicine and sometimes you're hamstringed by what the insurance will pay for and what they'll do.
Thank you for taking time out of your day to do this for me.
Oh, you're very welcome anytime.
Okay.